In this video we would like to introduce you to the ECG checklist for pediatric patients that can be found on eCare. This is a checklist to help guide you through ECG interpretation in children and when to seek advice from a senior doctor. Common indications for an ECG in children include, but are not limited to, chest pain, syncope, palpitations, cyanosis, seizures or funny turns, drug ingestion, abnormal cardiac examination, electrolyte abnormalities or a family history of sudden death or life-threatening event. Within the Trust there is no formal training on a systematic approach to pediatric ECGs, and there are considerable differences in their interpretation to adults. The ECG checklist is designed to guide you through the process, improve diagnostic accuracy, highlight when escalation is appropriate, and to improve documentation on eCare for future reference. Once the ECG has been completed, the checklist should be filled out by a doctor, and we will show you how to do this now. To find the ECG checklist, once on your patient's records, go to Ad hoc in the top left above the patient's name. Click on All Items and scroll down to the folder named Pediatrics. In there you will find the Paediatric ECG Checklist. We will walk through how to fill this out for a normal ECG. First, enter the indication for an ECG, e.g. seizure, syncope, chest pain. Following this, enter the speed and voltage. You then have the chance to enter any red flags associated with chest pain or syncope. Underneath this you can enter the rate. There are normal ranges provided for reference. Following this you enter the rhythm, sinus or other. If you choose other, it will ask you to input the rhythm. You then fill in the QRS axis, Q wave abnormalities, PR interval length, QRS, ST segment, and T wave morphology. There is also guidance on how to measure the QTC manually. At the end, you then have to decide whether the ECG is normal or abnormal. If abnormal, please fill in the abnormalities and discuss with a senior doctor. ECG checklist can then be found within documentation on the patient's notes. There is a QTC calculator located on the toolbar of the ECG checklist. To access this, click on the calculator icon in the toolbar and input the information required. It then calculates the QTC, which can be put into the ECG checklist as previously demonstrated.